Hold on. All right, welcome everyone, and thank you for joining us today. My name is Pam Rakanski. I'm the facilitator for the YES program, the YMCA Education Series program at the North Suburban YMCA. It's my pleasure to welcome you to Dr. Nicole Reidy. She will be talking today about Parkinson's disease, education, coping, and wellness. We are recording today's session so it can be available as a podcast, so you can watch this later on or tell your family and friends about it. It will be on our YouTube library. This series, this YMCA Education Series program lasts about an hour. Dr. Reidy will take questions at the end of the session, but we will have some in the chat box if they are pressing. All righty, and with that, we are going to welcome Dr. Reidy. Dr. Reidy, who works for American Parkinson Disease Association. We're going to hear about Parkinson's disease, education, coping, and wellness. Dr. Reidy is a licensed clinical social worker who earned her doctorate of social work at Aurora University. Her journey of social work careers includes providing bereavement counseling, creating enrichment activities for those with neurological diseases or diagnosis, and supporting older adults and caregivers with mental health counseling. She is now at the University of Chicago Medicine working as a social worker too in the neurology department, specifically with the movement-related disorders clinic. Welcome, Dr. Reidy.
Thank you so much for having me today. So today we're going to be talking about Parkinson's disease, the essential, and later on some coping and some suggestions as well too. So first of all, before we kind of go over some basics of Parkinson's disease, within the past several years and decades, there's been a variety of progress in research and treating and understanding causes and correlations to the diagnoses of Parkinson's disease, and what we can do as a community to enhance and enrich the quality of life. Something that is super important that we tell to all of our patients and in our support groups as well too is that although everyone in the group or our programs is diagnosed with Parkinson's disease, it is an individualized diagnosis. So we always say one individual with Parkinson's disease is one individual with Parkinson's disease. So it's important not to compare symptoms because everybody may be experiencing something differently. It's also important to understand that as one individual is diagnosed and the diagnosis does progress, it not only impacts the individual who is diagnosed, but it impacts their support system as well too. So friends, family, community at large. Our health system and doctors must be familiar with the signs and symptoms, different treatments, and how Parkinson's disease impacts an individual. And treating Parkinson's disease requires a team approach, which we are going to be talking about later. So what is Parkinson's disease? When we talk about Parkinson's disease, it's a disorder of the nervous system that can affect a person's ability to perform common and daily activities. So this can be concerns with cognition, this can be concerns with walking, with tremors, with holding something, with eating, being able to walk. So it causes motor symptoms or symptoms when we're moving, symptoms that are visible, and non-motor symptoms as well too. So this can be sleep problems, constipation, anxiety, depression is a huge one. Depression can be one of the main non-motor symptoms, fatigue, and other symptoms as well too. The motor symptoms are due to a lack of a brain chemical called dopamine, which can also impacts increase in depression, symptoms of depression with Parkinson's disease. So here are some of the main terms that you may hear if you are diagnosed with Parkinson's or if you know somebody diagnosed. So when somebody experiences a tremor, this can be a shaking in a certain type of a body movement. So that could be a hand, but there's kind of some shaking and instability. There can also be rigidity, so you may see stiffness in the legs and difficulty moving. It may take a little longer to move or to walk or to get into a comfortable position. There's also bradykinesia, and that is slowness. It may take somebody longer to walk. It may take somebody longer to sit down. It may take somebody longer to get moving. And the final one is posture instability. So you may hear different concerns with gait. So there may be problems with balance. Somebody may need a walker, physical therapy, occupational therapy. There may be difficulty in terms of feeling steady on your feet. And these are the motor symptoms of Parkinson's disease. So the things that are visible, something that a neurologist can physically see and assess. It's important to understand that when somebody does have Parkinson's disease, it's not just the physical aspect of it, but there are non-motor symptoms as well too. And each individual is going to have a different set of motor and non-motor symptoms. So like we said, it's important to not compare and also understand that if you may have a friend or a family member who has a certain symptom of Parkinson's disease, it does not mean that you are going to experience that as well too. So we are going to categorize a few different types of the non-motor symptoms. So there's neuropsychiatric. So one of the main things that we're going to want to look out for if somebody is diagnosed with Parkinson's disease is depression. And that is because there's a lack of dopamine in the brain that is being processed as well too. So it is very common for a variety of our patients, community members to experience increased symptoms of depression due to the dopamine, but also due to the different maybe limitations that they may have in terms of what they used to be able to do. People can also experience anxiety and sleep disorders. One of the main sleeping concerns that is noticed for individuals with Parkinson's disease is sometimes individuals will have kind of maybe what you can call lively dreams. So somebody may be dreaming, and during that dream, in their sleep, they may be kicking or hitting or maybe flailing their arms a little bit. So this is also known as kind of like active dreaming, and this is kind of one of the main sleep disorders that we see. There can also be cognitive concerns and dementia. This does not happen to everybody, but maybe later on in the diagnoses and the prognoses, there may be concerns with memory. And later on as well too, this is typically something that's later on in the prognoses, and like we said, this does not happen to everybody. But people may also get symptoms of hallucinations or delusions. Another symptom that is really important and that is also correlated with depression is apathy. So apathy occurs when somebody's experiencing maybe a lack of ability to feel or to have empathy or emotions. A lot of times you can see it in somebody's face. There's a lack of joy or a lack of ability to enjoy pleasure in the way that they used to, and there's like no motivation. So a lot of time the individual will have maybe more of like maybe like a strict face, and they're not really experiencing joy in the way that they used to. So apathy and depression can be similar. There are also sensory symptoms as well too. So people can have visual disturbances. Concerns with driving can be very common. We have a variety of individuals who've had to no longer and give up driving. There can also be a loss of smell and taste and different pain as well too. So this could be in your legs, in your arms, in your fingers. And then there can be autonomic symptoms as well too. So hypotension. Constipation is also one of the main symptoms that we hear a lot about as well too with Parkinson's disease. You know, a lot of people and individuals for a variety of reasons may feel a little hesitant or embarrassed to talk about constipation, but it's also really important to normalize that as well too, that this is something that is really common with Parkinson's disease. And if and when you talk to your neurologist about it, they can provide different suggestions as well too. And in addition to that, there can also be urinary dysfunction and sexual dysfunction as well too. So these are kind of the categories of the non-motor symptoms or things that may not be visually aware to. So So some of the statistics for Parkinson's disease are in the US, there's about 1 million cases, and there's 60,000 new cases each year. Someone is diagnosed with Parkinson's disease every 9 minutes, and the average age of onset is about 60 years old. So typically for Parkinson's disease, when we think of the diagnoses, it is maybe for older adults or people who are 60 and above. But it's also important to understand that there is also young onset Parkinson's disease. So this is categorized when somebody is diagnosed with Parkinson's disease before the age of 50. So about 10% of the cases develop before the age of 50. And I believe maybe the youngest diagnosis was anywhere from age 32 to 35. So it can be as young as that. And those are minimal of the cases, but it is important to also be aware and have different supportive services as well too. So men as a whole are 50% more likely to get diagnosed with Parkinson's disease than women. So we're going to be talking about different risk factors. So as mentioned, being the male sex, you have a higher risk factor for potentially being diagnosed with Parkinson's disease. It's also important to understand that there are different environmental factors. Through the American Parkinson's Disease Association, we have different articles and literature specific for vets as well too. There's different concerns in terms of Agent Orange. We've had I serve all of the Midwest area, so I've also been in contact with different farmers who are concerned of different chemicals that they've been using as well too. And if this is a correlation or a thought in terms of the potential correlation or diagnosis of the Parkinson's disease. So there's different environmental factors that are risk factors as well too to be aware of. Genetics is also a risk factor. However, there was a factor statistic, this is maybe 2 years ago, that in terms of genetics, it is and can be a risk factor. However, the statistics said that it was about 10% of the diagnoses of Parkinson's disease were due or correlated to genetics. So it is a risk factor. However, it wasn't the biggest risk factor or correlation or causation. So there is a chance, but it doesn't mean that just because a loved one has it means that you're going to get it as well too. And like I said, only 10% of diagnoses were correlated to genetics. As mentioned as well too, one of the other risk factors is age. Individuals who are 60 and above have a higher chance and probability and correlation of developing Parkinson's disease. In terms of genetics and Parkinson's disease, there's more than 20 genes that have been identified that can contribute to the risk of being diagnosed with Parkinson's disease. Most people do not have a mutation of the identified gene, and many more genes can contribute to Parkinson's disease, and some that have not even been discovered yet. As mentioned before, having a first-degree relative with Parkinson's disease modestly increases a person's risk of developing Parkinson's disease. So it is something to be aware of. However, there's not necessarily significant statistics that correlate to it just yet. In terms of the environmental factors, so as mentioned, there's different pesticides or solvents that can increase the risk of Parkinson's disease. People also who experience traumatic brain injury can experience a risk and potentially be diagnosed. And there are environmental factors that can interact with different genes to affect the Parkinson's disease risk. So in terms of treatments, we're going to be talking about a few different things that can assist in terms of enhancing an individual's overall well-being and quality of life. And these include medication, these include exercises, and deep brain stimulation. So in terms of medications, it's important to first know and understand that in terms of treating Parkinson's disease, there is not anything that we can do just yet that is a cure or that can stop the prognosis of Parkinson's disease. So there's no medication that we can take that can protect the neurons from degenerating. The goal with Parkinson's disease is to get the right amount of dose and tolerance of medication. So a lot of times, I get a lot of calls from community members and patients as well too. And sometimes they do experience different irritations and frustration because when you do start taking the medication, whether it's the carbidopa, levodopa, whatever medication you may be taking for your symptoms, if you are taking medication, it can and will take time to find the proper dose for you. So it's important to understand and to be patient during that process because it may take time. But once you find the right dose, you're going to feel more comfortable. Um, in addition, as the diagnosis progresses, there may need to be increased dosages, increased times that you're going to take it throughout the day. So it's important to keep in contact with your neurologist when you feel like there may be any medication change, if you feel like something isn't necessarily working as effectively. I always really advocate for patients. I'll get different phone calls of people telling me about medications. And I always say, I am a social worker. I would recommend that you reach out to your neurologist. That's what they're there for. And they want to make sure that the medications are working as effectively and as properly as possible. So please feel free to reach out to your neurologist and understand that it is a patient process and it takes a while to get the right goal to where it's most effective for you. Depending on the medication that you may be taking, there are different maybe responses or side effects that may occur. They do vary from person to person. Something that I reiterate a lot in our different support groups is, some people may say, okay, well, I'm taking this 3 times a day and I start at this time and I take it with or without protein. And that may be the magic tool for that person. However, it's important, as mentioned, not to compare and understand that, some individuals' symptoms may be different. They may need to take it right when they get up. They may need to take it 5 times a day, different dosages. So just because we may hear about somebody taking it in a certain aspect, it's going to be different for us. Our diagnosis with Parkinson's disease is unique to us, so we need to be mindful and aware of that. A person may take a combination of medications to control different symptoms. And something that I really advocate as well too, just in general, whoever you may be seeing, whether it's a primary care physician or if it's a geriatrician, make sure your geriatrician is looking over all of your medications and is looking over the side effects for any kind of contraindication that may be experiencing. Maybe there's one medication that doesn't work well with the medication from a cardiologist or a urologist. You want to make sure that somebody's looking over absolutely everything and any side effects that can be occurring so that you're aware of this too. So make sure you're talking to your PCP or geriatrician about this. So for medication and scheduling as well too, one of the other main things with Parkinson's disease is you need to make sure you are taking your medication on time as prescribed. So this is huge. Maybe it's different for, maybe other medications that you may be taking for blood pressure or something like that. However, once you've talked to your neurologist and you have found the right time, you may take it 3 times a day, but you need to take it at exactly 10 o'clock because if you don't, it can significantly impact your motor symptoms for the rest of the day. This can occur with a variety of patients, and I stress this, and the neurologist and healthcare professionals stress this a lot, that with Parkinson's disease, you need to take your medication on time. Not taking it on time can impact how you are feeling for the entire rest of the day. So whether you need to set an alarm on your phone, do set any kind of alarm clock, whatever you need to do, but make sure you're taking it on time. In addition to taking it on time, if you miss a dose, this can also have similar side effects, especially later in the disease and the diagnoses. So you want to make sure that you're taking things on time. Um, it's also important to be aware of any maybe symptoms or side effects that you're having from medications or drug interactions and food interactions. Something to talk to your neurologist about if you haven't already talked to them is when you're taking the medications, protein is really important in that. Follow up with your neurologist about this, but there may be, I think, there's a certain amount of time that we've talked about in some of our support groups that you want to take sure you're maybe not eating protein before taking your medication for a certain amount of times to increase the effectiveness and the overall strength and outcome of the medications. So ask your neurologist about protein. You should be or should not be eating protein within a certain amount of time of taking the drug or the medication as well too. Something else that can be helpful for anybody who has a smartphone, there is an app called the APDA Symptom Tracker app. So this is American Parkinson's Disease Symptom Tracker. And what's really nice on this app is you can list the medications you're taking, when you're taking it. You can put different side effects, how you're feeling, and you can even just say and write down how you're feeling from day to day. And this is something that can be logged and tracked to your neurologist as well too. You can also what's really nice is you can get reminders as to when your medication prescriptions refills are coming up as well too. So it'll tell you when you need to pick up and when you need to take your medication. You can log the symptoms that you're having or how you're feeling that day. And you can also add like family members or loved ones on the app as well too, so that they are able to see and monitor how you're feeling and how you're doing. Or if it is somebody who has maybe later stage diagnoses, and let's say maybe there are maybe some cognitive concerns or something like that going on, your loved ones can also be aware of when the medication refills need to be picked up. So I recommend looking at the APA Symptom Tracker app. In addition to that, there's also rehab therapies that can be useful as well too. So this can be different kinds of physical therapy. This can help with balance, walking, and strength. Speech therapy. Speech therapy is also huge for Parkinson's disease. This may not impact everyone to the same intensity, but it is and can be common for individuals diagnosed with Parkinson's disease to have difficulty with speech and communication and swallowing as well too. So in a few minutes, we're going to be watching a video that's through the LSVT. This is the Lee Silverman voice treatment. But if you are diagnosed with Parkinson's disease or you know somebody else with this diagnosis, communication can definitely be difficult and challenging. Due to the difficulty of communication, people typically can talk softer and slower, and it's maybe harder to hear. And not only is this a communication issue for them, but this can actually cause and correlate to increased social isolation and loneliness. People may not feel comfortable going to social or family events, or some people have mentioned that they go to family events or they go to social events and people are like, oh, I can't hear you. It's okay, it's whatever. So then that can also lead to embarrassment as well too. So we need to keep in mind that with all these therapies, it's not just the symptom that we're experiencing, but it's the different emotions and effects of those symptoms that we're experiencing as well too. And also keeping in mind that there's occupational therapy as well too for fine motor skills and independent living. Okay, so I'm gonna share the video really quickly on the speech therapy. So let me just pull that up really quickly. So I'm sharing the sound, so you guys should have no issue hearing it. So I'm gonna post this and you guys will see the speech therapy. This is a short video, only about 2 minutes. You'll see the pre-treatment and the post-treatment in terms of communication and speech. If you guys don't hear it, let me know, but there shouldn't be any issues.
Speech or your voice that you.
Yes, I don't speak loud enough a lot of times.
Anything else?
Hoarse.
Uh-huh. Anything else?
I stutter, which I never did before.
Do this for me if you would. Take a deep breath and say ah for as long as you can. Good for you. Okay. Would you say Parkinson's disease has caused you to talk less
Yes,
because?
because I stutter and then I can't be heard. If there's noise in the house, like when the kids come over, nobody pays attention to it because they can't hear me. Till I get mad and then yell.
Take a deep breath and say ah for as long as you can. Have you noticed changes in your speech or your voice as a result of the speech therapy?
Oh, yes.
What have you noticed?
I talk louder. I think louder. I'm going to sing with the Sons of Pioneers one of these days with my voice.
Good for you. That's excellent. What practicing do you do at home?
My ahs, my highs, and my lows. And I read out the mail out loud.
Excellent. Do you feel like practicing helps?
Oh, yes.
Okay. Do you feel as though people can understand you all of the time now?
Majority of the time, unless it's my husband, and he'll say, "What? I can't hear you."
Good for you.
But I think he does that just to be cute.
I think he does too.
Okay. So that is a little video that can help to show and understand how speech therapy can be very beneficial. And you guys see the pre and the post in terms of the communication. But not only that, you guys can see her affect and her behavior and her mood as well too, in terms of how it's different. So if you notice that this is a concern for you or one of your loved ones, if you just Google or look up, you should be able to look up LSVT. They have loud and they have big. And loud is for communication, help you to speak louder and more effectively and communicate better. And there's also LSVT for big. So this is for Parkinson's disease, difficulties with movements and getting around. What's really nice is you can put your zip code in and it actually shows different therapists right near you that you can contact and reach out to as well too. So I would encourage you guys doing that if that's something that you are interested in. So we're also going to be talking about managing well in terms of fitness and exercise as well too. So with Parkinson's disease, one of the main things that I've heard over and over and over again, which is really and truly important with Parkinson's disease, there's no way to, as of right now or as of yet, to cure the diagnoses, but to help maybe to help enhance your quality of life and maybe decrease the rapidness of the progression. Exercise is super, 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 super important. So this can include a variety of things. This doesn't have to include running. This can This can be whatever you can do and maybe increasing the intensity each day. So it does help to manage symptoms and improve quality of life. Not really moving around does increase the stiffness, stooped posture, and poor endurance. So the Center for Disease Control recommends 150 minutes of moderate or intensity, or 75 minutes of vigorous intensity of exercise per week for all older adults. So we actually had our physical therapist, I'm going to mention this later, but we have a variety of free educational and exercise meetings that are completely free of charge. And our physical therapist actually presented this week on Tuesday, and she gave a really good presentation. And one of her biggest takeaways that I always appreciate is when we're looking at the 150 minutes or the 75 minutes or whatever exercise that is, she says this does not include maybe like your average workout. So typically I walk to work, right? So that wouldn't include the 100 or the 150 or the 75 minutes. This needs to include something that is more intensity, something where you're working your body. So if you typically take a walk or something like that, it wouldn't include any of those activities that wouldn't necessarily, considering, what the physical therapist is saying, it wouldn't really include that in terms of the exercise or parts of the minutes, but it needs to be something where you're getting your heart up, something that's more endurance than your typical and normal activities. So keeping that in mind. So different exercises can be aerobic, strengthening, stretching, and balance as well. In terms of dietary considerations, something that there's different research on is the Mediterranean diet. So that's something to look over if you look on the American Parkinson's Disease Association website. We mentioned this earlier. In terms of protein, it can compete with levodopa for the small intestines, making medication doses less effective. So talk to your neurologist. There is a certain time period where you're supposed to either eat the protein before or eat protein after. At the end of the day, you want the medication to be the most effective for you. So talk to your neurologist about when you should be taking the protein. Something else too that we do encourage with a variety of our patients is it is important to definitely see a neurologist. But maybe something to look into for you for the future is, are you seeing a movement disorder specialist? So, maybe a neurologist is somebody who focuses in a variety of diagnoses, and they're well aware of different things such as maybe MS, ataxia, PSP, ALS. But a movement disorder specialist, this is somebody whose primary focus is in Parkinson's disease. This is their specialty, and this is what they know. So if that's something that you're interested in for the future, this may be better for when the disease does continue to progress. Look over and ask if you are seeing a movement disorder specialist, and if that's something that you'd be interested in the future. Constipation can be treated with different fluids and regular exercise. Feel free to talk to your neurologist about that as well too. Low blood pressure can be treated with fluids and salt. Another side effect of Parkinson's disease can be weight loss as well too. However, one of the main things that we had a neurologist come on to one of our meetings, and they said that keep in mind, these are all things that you can experience due to Parkinson's disease, right? So that weight loss is one of them. That can be a common symptom. However, it's important to understand that when you do experience a variety of these symptoms, that you don't just assume that it is due to your Parkinson's disease diagnoses. You also need to be following up with your primary care provider or other doctors as well too, because it could be due or correlated to a medical concern completely outside of Parkinson's disease. So you don't want to just experience something and be like, okay, this is Parkinson's, because we could be completely ignoring or neglecting another medical concern that needs attention. So feel free to also talk to your neurologist about any weight loss, even though this can be a common concern with Parkinson's. So as mentioned, there's a variety of benefits to the Mediterranean diet for brain health, and this you can have vegetables, fruits, grains, legumes, beans, peas, nuts, low-fat proteins, fish, and olive oil. One more thing before we follow up, I do want to just touch on it. This is something that would potentially be considered later on in the diagnoses. For anybody who is interested, there is a procedure called deep brain stimulation. And this is typically for individuals who later on in the prognosis may feel that the medications are not as effective as they used to be. So this can definitely be later on. It can help with tremors and different symptoms. However, definitely talk to your neurologist about that if that's something that you are considering. So in terms of healthcare, you want, as mentioned, you want to make sure you have a variety of individuals on your team. So this can be your neurologist, as mentioned. If you don't already have, and if you're looking for, you want to have a movement disorder specialist. Their focus is Parkinson's. You want to have psychosocial support. So this could be a psychiatrist, counselor, social worker, and psychologist. This could be exercise, dancing, Tai Chi, a primary care provider, nutritionist, PT, OT, and speech therapist. Me as a social worker, I would definitely recommend reaching out to any social worker at your facility that you may already have. Something that I do here at the University of Chicago is I actually call every single patient from our neurologist office. So we have Dr. Z and Dr. Padmanabhan. I call every single patient and I let them know that I called just to introduce myself and to also let them know that, even as of right now, if they don't need anything in the future, just know that I'm here if something does come up and they need a community resource. And people are really happy. They're like, oh, I didn't know I have a social worker. And it's great to know that if something does come up, I can reach out to you. So that is why we're here. And also just so everybody knows, I am with the University of Chicago, but I'm also with the American Parkinson's Disease Association. And I do serve all of the Midwest. So you guys can also reach out to me with any questions. So we do have a few minutes, so I'm gonna just talk a little bit about different ways to cope. In terms of any kind of diagnoses or health-related issue or any stress, we want to make sure that we're aware of who our psychological family is. So when I talk about a psychological family, this is different than maybe a biological family. So psychological family, this is basically you get to choose your own family and supports. So it's not somebody who's determined by DNA or, somebody who's blood related or something like this. So essentially, who do you consider to be the closest people to you? Is this a friend? Is this a neighbor? Is this somebody in a church? Is this somebody from a club or an organization? Is this maybe a little furry friend that you have? Or is this even somebody who, or is this even maybe like spirituality or faith or nature? When you're dealing with Parkinson's disease or other stressors, you need to know who is your support team. And this can also include medical professionals as well too. But you get to choose your own family and you get to choose your own supports. So it's important to understand and be aware of the people who are there for you during this time. Also being aware and keeping in mind that some people may need additional mental health services. So whether that's counseling, group support, we offer free group counseling services for Parkinson's disease. One of my main points that I want to touch on is in terms of Parkinson's disease and coping, we want to try to be able to externalize the blame. So what I mean when I'm saying that is, let's say you're having difficulty walking, or let's say you're having difficulty with frustration that you're not able to complete the task that maybe you used to 5 or 10 years ago. It's easy for me to get frustrated and to get mad at myself and say, "Oh, Nicole, what's wrong with you? You were able to do this before, why are you such a bad person?" Or just getting really mad and down at myself and getting frustrated. Whenever I get those thoughts and whenever I start to maybe blame or think less of myself, it's important to kind of like visualize a stop sign and stop myself. I did not wake up today and I did not think, okay, Nicole, I'm gonna make today a challenging day for myself. I'm not gonna be able to maybe walk in the way that I used to, or I may need help in terms of like feeding or getting dressed or something like that. I'm not choosing to do this. It's the Parkinson's disease, right? The Parkinson's disease is the culprit, and they are to blame. So when I get in a situation where I start feeling bad about myself and I start getting angry at myself, understand that you're not doing this to yourself. Get mad at the Parkinson's disease and understand that it's the Parkinson's disease to blame and not yourself. And to hopefully work on having some self-compassion with that as well too. Different ways to stay resilient through the process. So when we talk about resilience, it's the ability to persevere and keep going despite adversity. So regardless of what happens in your life, resilience is the ability to keep going and to want to persevere and to stay strong. When a stressor such as Parkinson's disease has no cure or solution, the goal is to build enough resilience to live with the ambiguity. So some suggestions for the coping are being emotion focused. So this can be crying, this can be journaling, counseling. This could also be talking to a friend, talking to a counselor. You want to make sure that you're expressing the emotion in any way that is healthy. Sitting with your grief is not wallowing. A lot of people feel, with Parkinson's disease, it's not just one grief, right? You're not just getting diagnosed with Parkinson's disease, but there's a variety of griefs, also known as complicated grief, that occur throughout the diagnoses. So it's important to understand that in terms of expressing the different emotions, that at time you're going to have to sit with it and work through it and experience it. And that's part of being resilient within the process as well too. Another aspect is being able to educate yourself. So with Parkinson's disease, like we said, one person with Parkinson's is one individual with the diagnoses. Everyone's going to be experiencing it differently. However, it may help just to be aware of maybe some things that we may experience or ways to be proactive, right? Even today, you're educating yourself on what are ways that I can maybe stay healthy, be proactive, maybe see some kind of a physical therapist. You're educating yourself to help yourself throughout the process. You can also advocate, work out, but it's also important to understand that when we talk about resilience, resilience does not always mean that we have to keep going until we're tired. Doing nothing is also resiliency as well too. So whether that's coming home from the meeting today and resting and watching our favorite TV show and, maybe hanging out with our dog or talking to a friend, resting is resilience as well too, because we can't keep going all the time. In terms of self-care for yourself, there's different ways to stay resilient and to be strong. One of them is being mindful and being aware of your own feelings and health. So, if you're having a really difficult day, feel free to set those boundaries. And if you need to cancel plans and if you need to take a nap or if you need to rest or communicate with your friends that you just need to be alone or rest or feel better, be aware of your feelings and health and don't be afraid to set those boundaries. Make sure that you're also talking to friends and eating well, getting enough sleep and exercise. With any kind of stress, feel free to debrief with a counselor, friends, or support each day as needed. So, I'm going to go over a little tool that was taught to me that I found to be very, very helpful. So I was in class one day, and one of my professors told us a tool that they used with one of their clients as a counselor, and she called it like a bucket. So, she said that, visualize having maybe like your stomach or your body is like holding a bucket. There's a string and it's filled with the variety of tasks or obligations that you have. So, let's say that could include work and family life and taking care of kids and maybe taking care of a dog or taking care of a spouse, going to health appointments, having to do my exercise, all these things. At some point, we're going to start to feel stressed and that bucket is going to overflow, right? So I'm visualizing the bucket and I'm visualizing all of these tasks that I have to do that are just overwhelming, that I know I can't get to, that also are not all priorities at the moment. So when I'm feeling stressed, I visualize this bucket and it's overflowing. What can I take out of the bucket that does not need to be there right now? That is not an absolute and ultimate priority. Maybe that's seeing my friends. Maybe that's catching up on some tasks or doing something for somebody that maybe I just can't do right now. I can't commit to, or maybe a friend or a family member. Keep in mind, taking them out of the bucket for today or tomorrow does not mean that they can't come back in, but it means for right now, I need to be aware of where I am at and my self-care, because if I can't take care of myself, it's going to impact my stress, it's going to impact the Parkinson's disease, it's going to impact everything. So be aware of what is in your bucket, what you can hold to capacity, and what needs to be taken out. The final slide that we're going to go over today is our REST acronym. So for R, that means relax. And when we say relax, that does not mean sleeping. That does not mean sleeping at night. Sleeping is different than resting. Sleeping is different than relaxing. So make sure you have time to relax. So whether that's watching a TV show, playing a game, going for a walk, take time to relax and to rehydrate. E is exercise and eat well. We mentioned this multiple times. For Parkinson's disease, make sure that you're doing something for exercise. It doesn't have to be anything that is so tiring, but it has to be something that's more intense than maybe a typical walk. S is for sleep and step outside. Make sure you're getting at least 8 hours of sleep and find a healthy sleep hygiene pattern. T is talking to somebody. We are not meant to do this alone. Reach out to a friend, loved one, or mental health professional, or even better yet, a Parkinson's disease support group. Now, there are a few things we aren't able to get to today, so I want to make sure that we do have time for questions. So I'm going to just fast forward them. If anybody does have a smartphone, and if you are looking for a stress management tool, I would encourage the Insight Timer app. You can see it. It's the little gold bowl right here. It's free of charge, and what's really nice is you can specifically say how much time you have. So let's say you have a medical appointment and you only have 5 minutes. You can choose 5 minutes, and you can choose I need stress, anxiety, relaxation, or a self-kindness meditation. All free of charge. For the American Parkinson's Disease Association, we have nationwide programs and services. So we have online resources, we have publications, webinars, a hotline. And we also have resources in English, Spanish, and Chinese. And then here are some additional APDA resources. Here at the University of Chicago, as mentioned, I serve the Midwest. However, if you are outside of the Midwest, that's not an exclusionary factor to receiving our services. we lead 6 different support groups, and we have exercise programs that include Tai Chi, dance, physical therapy, rock steady boxing. We have also had music therapy, we've had art therapy, we've had balance and strengthening. And then we have also had educational presentations from our neurologists, neurosurgeon, nutritionists, speech therapists, physical therapists, and occupational therapists. So all of our programming is completely free of charge. Anybody can join. If you are ever interested in joining any of our support groups, you can always reach out to me, and I can just add your name to our list. So Pam, that's all I have for now. I want to make sure that there's some time for questions as well too.
Thank you, Dr. Reidy. If there's any questions from the audience, feel free to put in the chat box or unmute yourself.
All right, we are unmuted. How do we reach you directly? You said you can reach us if somebody wants to join a support group.
Can you say that, Pam? I'm having difficulty hearing it.
Hold on. Dr. Reidy, they'd like to have your contact information if someone would like to join a support group.
Okay. So I'm posting it in the chat right now. Okay, so there's my email, nicole.reidy@uchicagomedicine.org, or this is my hotline. So either way, you can call me or email me. And then for our support groups, we have a monthly support group. We also have a support group. It's an 8-week group, and it's for people who've been diagnosed within the past 5 years. It's an 8-week group. We talk about medication, we talk about health, we talk about relationships. All of our groups have always been completely filled to capacity. We always have wait lists. So our press group is the one that is for people who've been diagnosed within the past 5 years. We also have a purpose support group. I have a caregiver support group. We also do have a new support group for the African American population. And I'm trying to think if I missed any, but I lead a total of 6 different support groups. So whether if you're looking for a monthly drop-in, if you're looking for a caregiver, if you're newly diagnosed, African American support group, purpose group, anything like that.
Are the groups virtual or in person?
Everything is virtual. So since
Okay.
we do serve the Midwest, and we are in Hyde Park, and maybe people don't feel comfortable coming here, or people aren't in the area. So everything is completely virtual and free of charge. So all you have to do is I send the Zoom link out right before, and I send you the hyperlink. All you have to do is click a button and you're on. So very easy.
But if they're full, are you accepting new people to these support groups?
So the support groups that are full are our closed groups. So if it's like the monthly group, that is no issue. If it's an exercise group, no issue. If it's an educational group, that's not an issue either. So like our press group, it's an 8-week closed group.
Got it.
We have our capacity to 12. And then the caregiver support group, it's also an 8-week group, and our capacity is at 12. And same with the purpose group, the capacity is at 12. So those groups are always filled, but we do have a wait list for all of them.
And so, would you ever open up more if you get enough interest, or can the people who miss on the wait list just go to the next 8-week group?
Pam, can you say that question? I had difficulty hearing.
I did too.
Oh, sorry. I don't know why. Can you hear me better now?
There's an echo, so just slow it down a little bit, I think.
I think it's okay. Well, thank you. We'll figure it out. Anybody else have questions?
Any other
Okay,
questions?
yeah, okay, got it. You guys have any questions for her? No, we don't have any more questions, but thank you very much. It was excellent.
Oh, good. If anybody has any questions, just feel free to reach out. Either email or phone call is probably the easiest way to get in contact with me, and I'd happy to let you know about any of the support groups or programs if you guys need anything. So
Thank you.
thank you.
Thank you very much.
All right, thank you. That concludes our talk. Thank you to Dr. Reidy. Thank you to the American Parkinson Disease Association. Our next talk is, sorry, I just had it in front of me. It is on May 22nd at 7 p.m., Wednesday, May 22nd. It's on foot pain with IBJI. So if you have any foot pain, check us out virtually on May 22nd. Thank you again, Dr. Reidy. I hope we get to have you again sometime soon in the fall or something. So
Thank you so much. Take care. Have a good day.
have a great day, everyone. Bye.